Okay, so this is the Systems of Belonging presentation for IPTS, and I'm Alex Solentrop. I'm in the PT program.
I'm Josie Topiwell, and I'm from the OT program.
I'm Katie Schmoody, and I'm from the PT program.
I'm Madeline Rosebrough, and I'm from the PA program.
I'm Michaela Sherrill, and I'm from the pharmacy program.
I'm Nathan Ramos, and I'm from the School of Medicine program.
And I'm Raleigh Schmidt. I'm in the School of Nursing program.
So for our case background, physicians are leaving the healthcare industry at a rate 4 times higher than before the COVID-19 pandemic manifested. This new influx of patients and increased rate of healthcare worker resignations has negatively impacted interprofessional healthcare teams. Healthcare workers report increased levels of compassion, fatigue, exhaustion, work-related stress, and mental health challenges since the start of the pandemic. The COVID-19 pandemic has had a significant negative impact on those infected who those identify as Black, Indigenous, and people of color. These individuals have been affected disproportionately and suffer higher rates of morbidity and mortality at the hands of COVID-19.
So for some additional case background, the Health Fairview is a partnership between Fairview Health Services, the University of Minnesota, and the University of Minnesota Physicians. The partnership works so patients have access to quality care and advances in medicine, and it began the Hope Commission, which is a separate effort to provide an inclusive environment to patients and healthcare workers alike. And their goal overall is to provide a sense of radical belonging. And we're talking about how we can achieve this today. So I'm just going to go through some of our team members. So our first team member is a Black cis heterosexual woman who works as a family medicine physician. She was born in Kenya and is Somalian, and she's currently married with two children and is active in the Islamic community. She's very committed to providing patient-centered care and is discouraged with how rushed patient interactions are since COVID. Recently, she has also felt unsafe sharing her political and social beliefs with patients and staff. Our next team member is a cis heterosexual woman who practices at the hospital as a nurse. She is a Midwestern American who identifies as Christian, and she's single with 2 children. She's hoping to go back to school, but struggles to find time due to being a single parent. She has issues maintaining a good work-life balance and is frustrated when other parents at daycare and her friends refuse to wear masks.
Our next team member is Jessie. Jessie is a cis lesbian woman who works as a nursing aide. She was born in the US and identifies as Latina. Jessie is married with no children and practices the Christian faith. She strives to connect and build relationships with the patients, but has been told by her supervisor that this behavior is inappropriate. Jessie often feels ostracized by staff who repeatedly make homophobic and racist remarks. Jessie wishes to become a social worker, but feels this goal is too unrealistic. Jonas is a cis heterosexual Black man who works at the hospital in environmental services. He is Latino and was born in the Dominican Republic. Jonas practices Christianity and serves as a caretaker for his older parents. He is worried his occupation puts him at risk for developing COVID-19 and passing it on to his parents. Jonas enjoys his work and has made friends at the hospital, but often feels underpaid and underappreciated. Andrea is a cis heterosexual woman who works at the hospital as a quality representative. She was born in Northeastern America and is single with no children. Andrea is not religious. Her work leaves her feeling drained, and she runs and socializes after work less and less often. She is struggling from burnout and feels as if she is unable to make a measurable difference in the healthcare system. So what is radical belonging? Radical belonging is affirming another's multiple identities and supporting them to engage in their duties to the best of their abilities. Radical belonging is the transformative change aimed at interrupting endemic racism to secure social, academic, and democratic belongs for every member of the learning community. Radical belonging requires transformative change to root out the racism endemic to schooling in the United States. Community is the key unit of change. Radical belonging is a communal experience stemming from collective action. There are three aspects of radical belonging, and they are social belonging, academic belonging, and democratic belonging.
Why is a sense of belonging important? A sense of belonging can be felt when an individual wants to focus on building a relationship with one another and that humans have an instinctive need of it. This concept of belonging is crucial to life satisfaction along with our physical and mental health. The sense or need to belong is influenced by many socioeconomic factors. The Department of Psychiatry and Behavioral Sciences at Stanford Medicine mentioned that the COVID pandemic has highlighted how important it is to work towards a more integrated theory and practice of well-being, which is increasingly understood as a combination of many factors, psychosocial, biological, genetic, and environmental, and bearing crucially on our shared need to belong. Belonging cannot be cultivated without a parallel intellectual and moral commitment to underlying issues of equity and justice. The lack of belonging could lead to a negative worldview of mistrust and rejection, which is why our proposal is necessary into attempting to reach optimal belonging.
So why is the wellness of healthcare team members critical? So stress, exhaustion, and overall fatigue have become increasingly more prevalent among healthcare workers, especially with COVID-19 creating a heavy workload. Naturally, healthcare workers are struggling to meet the high demand, and everyone will suffer the effects of overworked, short-staffed healthcare teams. Lack of sleep and high amounts of pressure can lead to errors. This can lead to negative health outcomes for patients. If the healthcare team is not at its best, then patients cannot receive the best possible care.
So now we are gonna talk about our specific ideas on how to improve belonging in this healthcare system. And our proposal includes small changes within the workplace that could have a big impact on employee burnout and a sense of radical belonging, which will in turn improve patient outcomes. So we all know that burnout is out of control in employees right now, and it is also directly related to medical error. The more burnout there is, the more errors that our physicians and nurses, et cetera, are making. And those errors cost the hospitals greatly. So although we will be requiring some financial investment in these things, we believe that the money put in will be less than the money we would be losing if burnout continues as it is. So implementing these changes would indirectly save the healthcare system money through decreasing burnout-related medical errors. And incorporating our suggestions, because they are small changes, it will have a minimal financial impact. The biggest undertaking financially will be hiring more employees, which we will talk about, such as social workers and staff advocates.
So at the organizational level, we propose that social workers should be available to both staff and patients. We also think it's important for wellness rooms with staff advocates to be available for all employees to just take a break from their work when they need it and when they're feeling a little bit of burnout. It's also important that DEI is a part of the mission statement and values of the company. Additionally, signs and health-related materials should demonstrate diversity, both within the employees and the staff, and also handouts that we're giving to patients. Additionally, options for single occupancy and or gender neutral bathrooms should be available to improve a sense of belonging, and commitment to hiring and providing opportunities to people of color will improve the sense of belonging in the healthcare system. And finally, at the organizational level, providing an outlet for healthcare workers to discuss frustrations and concerns would help them to cope with their demanding jobs. This could be through some of the ways that we have already mentioned, such as having social workers available on site for the staff, and some ways that we'll talk about in the next coming slides. And this will create a space for open communication and help to lessen the feelings of isolation. On the team level, we think that the team should push for equity to eliminate barriers in the workplace. So if you look at the little picture to the right, there's equality where everybody receives the same thing. Everybody's standing on one box, but as you can see, that's not equitable for everyone that's trying to watch this game. So equity is giving everyone what they need to succeed. And for each individual, that's not always the same exact thing. So pushing for equity will help to eliminate some of the barriers in the healthcare system. Additionally, leaders should ask the team for feedback and strive for an open door policy so team members feel comfortable sharing their concerns and they can feel heard. We think the team should put into place a mentorship program, not only for new employees, but also for current employees, just to have someone to go to if they're not comfortable going to their leader or they need advice on something in the workplace. And finally, the professional teams should unite on reachable and measurable goals to improve radical belonging.
So on the basis of the individual level, we would like to encourage our staff to take a Harvard implicit bias quiz, which has options for age, religion, sexuality, race, weight, disability, and more. Just so that internally people can process like where they're coming from, but then also kind of giving us a foundation for us to figure out like, all right, where can we grow as an organization if everybody is kind of understanding where they're coming from. We also have professional identity development program, which would involve reconciling individual and professional identities and recognizing common goals, again, amongst that we might have internally to see if we can express that as an entire organization. Also looking into proposing allotment of counseling time and opportunities for employees within company benefit plans, where that counseling time is provided with them upon employment at the organization. And then also rewarding employees that are attending, hospital-based inclusion seminars and modules. If they're completing these things, they should be rewarded and hopefully, leading that charge of increasing this sense of wellness amongst the people in the organization. On a short-term plan, we want to be able to have these team and individual proposal goals. We want to be worked on immediately on more smaller levels, and then so the larger level organizational changes are going to take some more time. So go ahead and get those in place first, and then move into organizational. Start small so we can maybe work on bigger. Let the mission statements, with the emphasis on diversity, equality, and inclusion, we want that to set the framework for our team, team-based programs that we're doing. We want to, again, more reward programs where they're rewarding teams when they are proposing individual, like unit-based and floor-based team or community building initiatives. We want to reward them for doing such things, and we need them to be able to create them on an individual level. Because sometimes it's better to have things tailor-made for the needs on that specific floor and for that specific population in that unit. Also, a shot in the dark, trying to do facilitating interprofessional drop-in lunches on each unit, saying, hey, if you're part of environmental services, nursing team, respiratory team, pharmacy team, and medical team, all on the same unit, like, let's try to drop in at similar times where, let's all grab food together. I know everybody has about 5 minutes for lunch. That's typical of the healthcare workplace, but trying something where they can reach out, where it's not just always talking about, professional ideas all the time. Sometimes it's like, hey man, how's your week going? And just building that sense of community on starting with just a unit and then maybe even large to the entire organization. And then lastly, specify social work and chaplaincy representatives assigned solely for employees, where it's like, these are not people that are having to bounce in and out of working with patients and employees. This is somebody like, it is only for employees for them to use and for their disposal. And then with our long-term plan, we're looking at repurposing some of those less utilized rooms. We want to use wellness rooms. We want to be able to give safe spaces to our employees. We need to invest in our employees. We need to hire staff advocate positions. The better that we invest in the staff that we have right now, the less that we have to invest in hiring initiatives that are very costly and cost a lot of money to the organization. So being able to invest in the staff that we have there at that time, that's going to pay off dividends. Again, hiring more social workers so that they can be shared with the faculty as well as the patients. We want to see more chaplaincy and spiritual advocacy patients for our employees, because people are going to be coming from different areas and they are trained in dealing with religions and spiritual backgrounds of all types. That is their role, and having them to be able to understand where each worker is coming from a spiritual background. We want to prepare for future hiring and employee retention initiatives for whatever future public health crises occur, because they're going to. COVID-19 is not going to be the last time we deal with a public health crisis. So making sure we're ready for the future is going to be very important. And then lastly, reviewing those team and unit-based engagement initiatives. If any of them were working on a unit level, try and see if we can bring it bigger and say, is this something that we can use as an entire organization so that we can lead our organization into success?
So to be able to assess the success of the implementation of our proposal, we will be utilizing the following outcome measures. The implicit association test, or IAT, which measures the implicit prejudice among individuals. If successful, the implicit biases should be reduced in post-testing. And then another outcome measure we would use would be the quality of life, depression, anxiety, and stress scale. And this measures both perceived quality of life and level of depression, anxiety, and stress. If successful, our team will report a better quality of life and decreased levels of stress and anxiety during the post-testing.
So as we, as a group, looked and started to work on this project and start to brainstorm ideas, we wanted to be realistic, because if you go back to our introduction and the team members that we were presented, it's very realistic scenarios. These are real problems that people are dealing with right now and will deal with in the future, and we'll have coworkers dealing with this in the future. And so we wanted to put that with realistic solutions that could actually be manageable and that management would buy into and actually be willing to do. And so even though like a big, large scale reform could be shiny and enticing, that's not realistic. No one's actually going to do that. So we went for more small changes that could like build up and have a larger impact over time. And that is also much more realistic financially, because those big, huge reforms come with a lot of disruption and a lot of financial investment. But if we do smaller things that are more reasonable, management is going to be willing to do it because it won't be costing them, and much more realistic. And these are real problems, and we need to have realistic solutions. And financially reasonable moves allow for more buy-in across leadership ranks, like I said, especially when they are focused on supporting the workforce, because it's much cheaper to have employee retention than new hires and onboarding all the time. And then as we were brainstorming all these small changes, we discovered that these can actually have a huge cascading positive effect and a huge morale boost for our theoretical coworkers, because it really is the small things that add up and break you, or it's the small things that your workplace does that add up and make you really passionate about working there and end in better outcomes. And then through this, we also realized that every team member brings both gifts and baggage to work each day. And realizing that when you're interacting with them and trying not to get frustrated can really improve understanding as we are working interprofessionally as a healthcare team. And that's just what life is. And as we saw, it was a range of different problems seen with each member of the team, and really what they needed was more support and more resources, and that's what we tried to provide in our proposal. And these are our resources.